Hello, I'm Roberto Melis, 43 years old. I'm living in Abu Dhabi more than 4 years and working here as a mechanical engineer. And I'm here to explain my story. I was suffering about this loss of voice since many years, and it caused me some difficulties on my job, on my socializing with people. And after trying to find a solution of my problem, finally I met Dr. John Victor in NMC hospital. And also I was suffering about some problem. I was choking while eating. This problem was not only about my voice, it caused me some choking while eating, some problem with breathing. Dr. Victor explained me very well the procedure about the surgery, so I was feeling very confident with him. The surgery went very well. The recovery also was very good. Now it's 2 weeks I did this surgery. My voice for sure is much better, and they explain me it will improve day by day. I can feel it. So I'm very glad to meet Dr. Victor, Miss Menou, and all team. The surgery was very good. The team was fantastic. The scar is very small. Now only 2 weeks passed, but it's almost gone. Currently, Miss Menou is taking care of my voice. She's my voice therapist, and I feel it's improving day by day. I'm super happy about my voice now and confident.
Hi, I'm Dr. John Victor, consultant ENT surgeon in NMC Specialty Hospital. So we are a tertiary referral center for voice-related disorders. So we have a wide spectrum of treatment modalities, right from voice therapy to injection laryngoplasty and more definitive thyroplasty. So injection laryngoplasty is a procedure where we inject calcium hydroxyapatite. That is the common filler used in cosmetic surgeries. So we inject it into the vocal cord to add the bulk to the vocal cord so that the voice becomes loud. But this one is a temporary procedure. So we wait for the body to recover or to compensate, or some cases the voice doesn't recover after 2 years. So in such cases we go for thyroplasties. It's a more definitive procedure. It's a surgical procedure, and there are different types of thyroplasties. Type 1 is to increase the loudness of the voice. Usually after thyroidectomy surgeries, the voice becomes weak for some people because of injury to the recurrent laryngeal nerve. So in type 1, we medialize the vocal cord so that the voice becomes loud. In type 2 thyroplasty, the voice is very spastic because of neurogenic conditions. So in such cases, we relax the voice. So it's more of a relaxation surgery. Type 3 surgery is to make the voice more masculine. In puberphonia adolescents and young males, when the voice doesn't crack up. So we offer this surgery that is to make the voice more masculine. In type 4, we make the voice more feminine. That is done in transsexuals who have a rough voice. So in our case, Mr. Roberto, he came to us with difficulty in projecting his voice. He had a very weak voice and he had choking episodes during while eating. So we diagnosed the condition, and then we offered him speech therapy, and then we moved over to injection laryngoplasty. He was very happy with the laryngoplasty. But as I said, it lasts only for 2 years. So after 2 years, his symptoms recurred. That's when we offered the thyroplasty. Thyroplasty is a surgical procedure So usually a silicone block is inserted with a surgical window, and it is done under local anesthesia. So in his case, we did something new. Instead of the silicone, we inserted Gore-Tex. This is a common material used in vascular reanastomosis. So the advantage of this Gore-Tex is that it can fine-tune the voice. During surgery, we can fine-tune the voice to exact requirement of the patient. Another advantage is that it is a reversible process. If by chance the vocal cord recovers, if the nerve starts functioning again, this Gore-Tex can be removed easily, unlike a silicone block. So this has its own advantages, and we were happy to offer him that. And the results are really good, and it's impressive. And he, of course, has to go through the voice therapy from Ms. Minu, and she'll take care of the patient. I'm sure the patient will be very happy at the end of the treatment. So this is a very unique surgery, and it requires a lot of fine work. And we are the only hospital in Abu Dhabi to give these services at the moment. And you can, for yourself, see the difference in the voice. And this is the voice of the patient before the surgery.
2, 3, 4.
This is the voice of the patient after the surgery.
1, 2, 3, 4.
Yeah, as you can see, the voice is significantly improved. And now he'll be under the care of Miss Minu. So she'll take care of the voice for the post-operative voice therapy.
Hi, my name is Minu. I'm working as speech language pathologist at NMC Specialty Hospital, Abu Dhabi. In simple terms, speech disorders involve difficulty in production of sounds, and language disorders involve difficulty with the use and understanding of words. So here I do individualized therapy sessions tailored for the particular condition, dealing with both adult and child cases to overcome the challenges of communication by facilitating better speech and language. In our speech therapy clinic, we do voice therapy for individuals undergone different surgeries or has different voice challenges. They face difficulty to projecting the voice. Then we do with voice therapy to make their voice with better quality, make them have better pitch control, and facilitate enough loudness for the voice. So my case, Roberto, came for voice therapy after his post-surgery with Dr. John Victor, and he was very happy when he came for the therapy session, and he got much benefit from his surgery, and currently his voice is much better. So during the evaluation time, I could find he need to get much more efficiency in vocal function, so that I find his voice sounds to be little rough on my part, as well as he has some cracky voice and he has some pitch breaks in between when he speaks. So I need to improve his breath control as well as and breath support. If he's go for much specific, I need to improve his breath control and breath support. So I had given him with some exercises which facilitate and helps to promote all the 3 subsystems of speech involving phonatory, respiratory, as well as breath control that can make him to have better sounding voice. And I expect him to have much healthy vocal functions after the complete sessions of therapy. Usually people are unaware of this, that the voice therapy is also needed to make the voice sounds better. So after medialization, thyroplasty, or any surgical procedures, or any individual who face a weakness or lack of projecting the voice or vocal fatigue towards the end of the day, such symptoms needs to be undergo voice therapy to make the wall intervention part to come in a concluded and most definitive outcome to be happen. Voice therapy after medialization thyroplasty is very crucial for the surgical outcomes to be get optimized. So it helps the individuals to adapt to the vocal cord function and vocal effectiveness, and thereby make his or her voice sounds much strong and clear.